Hi, I'm Andrea, your medical doctor.
And I'm Elysia, your registered dietitian.
Welcome, and this is the
Peared podcast. So, Andy, how was your week?
It was long. A very long
What
week.
were you doing?
Classes and,
Yeah.
updating my knowledge. It takes a lot to be a student again.
I know. How long has it been since you've been a student? It's been years.
Yeah, it feels like years, but officially...
Giving away your age.
Yeah, officially back at campus for 2 weeks.
Okay.
So adjusting to that. But it's been a good week, learning a lot. And yours?
Oh, my week has been long as well. It's been hectic. I don't know why. The beginning of this year, 2025, has come in with a bang, eh? And this week I've been just feeling so tired. So abnormally tired.
Why? What do you think?
I don't know. Well, I think it's my PCOS. I've also been struggling with anxiety and stress. This week, you just wake up feeling this way.
So you're not sleeping well.
It's so crappy, honestly.
Do you feel that you're not sleeping well?
No.
Okay.
I struggle to fall asleep at night.
Is that an ongoing thing, or was it just this week?
I think there's certain weeks where I struggle with it and certain weeks where I can fall asleep, immediately when my head hits the pillow.
Okay.
And then there's certain weeks where I'm when you fall asleep but you're not asleep, you're awake, you can hear everything. I think the quality of sleep is not
light
great.
sleeping.
Yes, yeah.
And
so
sleep is so important. It's something I'm so passionate about. It's something I really want to speak about in upcoming episodes, because that, needs a full episode.
Yes,
sleep.
That's true.
Sleep is, the new in word. Everyone wants quality sleep, and it's so I think we're realizing how important it is. In the past it was sleep is for the weak.
Sleep was for when you grow.
Now
I slept a lot and I'm still short.
We both I think I'm also catching up on sleep. Years of being sleep deprived. I always feel like you are catching up on sleep.
That's true.
I value sleep so much more now that I have it. The privilege of being able to sleep is so important. Anyway, you mentioned PCOS. What is that? What are you talking about?
So, a few years ago, I was diagnosed with PCOS, which is Polycystic Ovary Syndrome.
Okay.
Yeah. So it's basically, you can actually tell us about it, right?
So PCOS, we use the Rotterdam criteria. Because I was going to say, some of your symptoms sound like you having, symptoms of PCOS. And for those who are listening, might not understand what PCOS is. It's a complex diagnosis because it's not based on one thing. Some people have various symptoms, some don't have symptoms which are present, so it can be a bit difficult to diagnose. So they use the Rotterdam criteria, and usually you have to have 2 of the 3 to be diagnosed with it. And it basically speaks to ovulation issues, so irregular, that will display itself as having irregular periods, or sometimes not having periods at all. So that's the one of the 3. And then the second one would be high androgens. So androgens are usually your male hormones, such as testosterone, and that would display itself as having excess body hair, excess hair on your face, as well as acne, usually cystic acne, as well as male or female pattern hair loss, so alopecia, and that would be androgenic alopecia. So that those are the 2 that we are speaking about. The third one would be what we'd see on the ultrasound. So polycystic ovaries, people think it's cysts, but it's actually the follicles that we are seeing, which are fluid-filled follicles. And on the ultrasound, it might look like what they call pearls, like a string of pearls present on the ultrasound. So for you to be diagnosed with PCOS, you should have all of these, tested. So 2 of the 3. But that being said, not everyone might have access to these tests. And testing, for example, the high androgen levels is not always necessary if you have the features of it. So if you, for instance, have the excess body hair or the alopecia, the hair loss,
the acne,
you know, you don't need those hormone levels to be tested.
Yeah.
Because it encompasses all of those features.
Yeah.
You understand?
Yeah.
But in order to strengthen the diagnosis, to be certain, we obviously have to rule out other causes because it is a hormonal imbalance.
Yeah.
And it affects not only your endocrine system, which is your hormone system, but also affects your reproductive system. So it's a complex condition
disease,
to live with and affects all aspects of your life. I mean, what are some of the symptoms?
Yeah, I think the first symptom that I experienced was the hair loss. I don't know. Do you remember me from high school? I used to have such thick hair.
Thick and long.
Like my hair was so thick. And now like it's thin. So that was the first symptom that I noticed. And then there was weight gain. But I know that's not part of the criteria. But the weight gain was the other. And then what was my other symptom? Acne. I had bad acne. And I never ever struggled. Like throughout
you had clear.
Literally.
I had acne.
And it was so weird because it was like, I think I got diagnosed when I was like 26, 27.
Yeah.
And that's when the acne came in. And I was like, this feels like I'm a teenager again.
Yeah.
Yeah. So those were the two symptoms that I remember. I went to the doctor and I was like, I don't have hair here.
Shame.
It was like in this area.
Yeah.
On top of my head. It was fine.
In the middle,
but
usually.
Yes. Like you just see your path kind of like getting wider. And which is quite sad, especially like being a female.
Yeah.
You know, like you don't feel pretty anymore.
Yeah, because
your hair is like
part
falling
of
out.
Your makeup.
Exactly.
It's part of your identity.
Yes.
And skin as well.
Yes.
So I think it's such a complex thing because your identity and everything that you feel as a woman just feels out of balance.
Exactly. And the acne was so, like, for me, like you said, it was cystic acne, but I don't think I had cystic, but it was so inflamed, my face. It was so painful, like, to lay on your pillow at night. It was sore.
Shame.
So it was...
That sounds horrible.
Yeah, it was horrible.
And
but I don't, like, luckily
your skin
now,
is
my
looking
skin
good.
is... I mean, yeah, I went to the dermatologist. So.
Yes. So that's exactly the thing. I think... because it affects so many of your systems, it's so difficult to manage because you literally need a team of doctors or a team of specialists to manage it. And it's so important for doctors and people to be aware that there's overlapping of symptoms, but of specialities, because like you needed to go to a dermatologist as well as what other
a gynae, obviously. They kind of diagnose you, and a dietitian is so important. And I think like recently also gastroenterologist, because like a lot of PCOS women also struggle with IBS symptoms. I'm one of them, but that's also another symptom. But
there's a lot of symptoms as well. So there's the criteria that we need to diagnose it, which we've spoken about.
Yes.
But then alongside that, there's a multitude of symptoms, like you've expressed, that might not be needed for the diagnosis.
Yes.
And I think that's where the confusion lies.
Yeah.
What is symptoms and what is diagnosis?
Yeah, that's
and
true.
And everyone is different.
Yeah.
So I think that makes it even more difficult to hone onto and to actually finalize that diagnosis. So many women go for months without being diagnosed. And
I feel like that was me. Like months where you just... your hair is falling out, it's all over the floor, but you don't like kind of like, oh, there's something wrong with me. You think it's normal. You start gaining weight. Also, that's like, what's wrong with... maybe I'm eating too much, but then you like go and you're like, no, but I barely ate today.
Anything.
Yeah, like I ate one meal today, and it wasn't even that much. Why am I gaining weight? You know,
and it happens overnight. Almost.
Literally, like you don't see it coming until you're like, wait a minute, this isn't normal. Like I've lost half of my head of hair.
Yeah.
You know, like where it gets to a point where it's so bad that you're like, okay, I actually have to see someone.
And people might dismiss it.
Exactly.
Or doctors might dismiss it and say, you know, you're stressed.
Yeah.
You're studying. You're studying to be a dietitian. Like,
Yeah, I actually thought it was stress when my hair started falling out first.
I mean, stress can affect your hair,
Yes.
but when there's other symptoms, I mean, also your period, something that might be masked if you're on contraception or family planning, might, mask that your period is irregular. So sometimes women suffer for years without understanding what's actually going on with their body, like you did.
Yeah.
And with regards to the being a dietitian and the weight gain, how did that happen? How did you feel when it happened?
Wow, yeah, like it was difficult, because you like, I'm a dietitian, I should be like a certain
weight.
Look, like you're a dietitian, you should be like, I want to say skinny, but not skinny, like healthy.
Yeah.
And then I didn't feel healthy because, and also like struggling with weight is difficult because I was exercising like how I usually do.
You were always active.
Yes, and I don't eat unhealthy at all. Like I eat quite healthy. I mean, I barely have takeouts. I don't eat sugary things.
You prepare all your food.
Literally.
You love cooking.
Exactly. So I don't eat that healthy, and then you're like, where does this weight loss come? So
weight gain.
Weight gain.
That's fine.
Weight loss. We want weight loss.
Yeah.
And then it's like a cycle. Hey, you like try and lose the weight. You don't see any results. You get stressed about it, and then you gain more weight because the weight gain is more from the hormonal imbalance.
And that's what people don't understand.
Exactly.
So yeah, I mean, in our previous podcast episode we spoke about weight loss.
Yes.
And it's important to note that there's many things that drive weight gain, like we have spoken today about polycystic ovarian syndrome and other causes of endocrine hormonal imbalances. So important to note that it's not just purely a you problem or a lifestyle problem. There might be other issues at hand. It's amazing, the journey, because when you are the patient,
right,
you understand it better as a dietitian. And what were the type of dietary adjustments? Actually, what are the dietary recommendations that were made to you? Because that's quite interesting.
So the first health professional that I saw, well, actually, a lot of health professionals, doctors, would tell me to cut out carbs. And I'd be sitting there like, I'm a dietitian, right?
I know this isn't correct advice, but carry on.
I'm like, okay, cool. I think I also got like this diet of like, eat Provitas and tuna as
Seriously?
and like go plant-based. And I'm not saying that those won't benefit. Yes, it would benefit because you're going to lose weight on like a low-carb diet. And low-carb diets are known for women with PCOS because a majority of women with PCOS have insulin resistance. So in order to treat your insulin resistance or to get better with your glucose control, obviously you need to go on a lower carb diet, a higher fiber diet to improve your insulin sensitivity. But not all women have insulin resistance in PCOS.
Okay.
So that's the thing of, is that going to work for me and my body? Or
does it not matter? Because now I'm saying for if you aren't insulin resistant, then you essentially should just eat healthy carbs or carbs that are undefined.
I mean, like a lower carb diet is not going to be detrimental if you don't have insulin resistance. It's obviously going to prevent insulin resistance because that's a risk. When you have PCOS, you're at high risk of getting insulin resistance because of your hormonal imbalance.
Okay.
So having a high fiber diet, a lower carb diet is going to be beneficial in any case.
But not eliminating.
The carbohydrates.
Because that's too restrictive.
Exactly.
I mean,
so restrictive.
Life is all about balance. And finding that balance that works for you is so important. And everyone is different. I think that, it's so difficult because you want to give advice, one size fits all approach. But
it doesn't.
You can't.
It doesn't.
And, speaking about these topics just to give general advice so that people have some sort of guidance is so important.
Exactly.
So if you were to see another woman with PCOS and you were to help them, plan their meals, and with the aim of maybe weight reduction or fat reduction, what would you then suggest?
Okay, so for general, I'm gonna do like a general PCOS friendly like tips kind of. So definitely we want to go for a high fiber diet.
Okay.
So, and we can choose like lower GI carbohydrates as well.
Okay.
So higher fiber diet. So we're gonna go for if you're looking on the food label, any per 100 grams, the fiber needs to be more than 6 grams.
Okay.
Per 100 grams. Then you know that's a high fiber food. So your whole grains, your whole wheat, carbohydrates, and then the lower GI ones is also whole wheat, whole grain. And then also decrease saturated fats, because saturated fats is going to cause that hormonal imbalance. The more fats that you have. Exactly. So it's going to make your PCOS worse, or your PCOS symptoms worse. And then I also want to say processed foods, decreasing processed foods. It's also bad for the hormones.
Yeah, the ultra processed foods, as I've heard.
Exactly.
So ultra processed foods such as
like your Viennas, your hams, certain hams. What else is processed? Sometimes this happens.
It's difficult to categorize
Polony,
it. Oh my gosh.
Your Russian Viennas.
Don't get me started.
Sausages.
That's one thing, that we've proven in science. The ultra processed meats.
Yes, because I put so many things in it, like you don't even know. And it's so bad for your body.
And they've proven that it's linked to cancer.
Exactly.
So GIT cancers.
Exactly.
Anyway.
And it also with the hormones.
It's just a bad mix.
Yeah.
But yet we still eat it.
I know, because sometimes it tastes good.
I think in moderation.
Yeah.
Moderation being once a year.
Yeah. But you know what's crazy?
In my opinion.
Once you cut it out, you won't be able to eat it again. I mean, I think I cut it out. And I can't eat polony anymore. And Viennas.
I think once you also realize that it's just so bad for you.
Yeah.
It's so bad for you.
And then and portion control. Also, I think we spoke about it in our previous episodes. Same thing, decrease portions. Eat in smaller plates. That will help with decreasing portions.
We've been doing that.
Really?
As a family, we've been eating on smaller plates, and it makes such a big difference.
It really does. Because you feel like you're like, I finished my plate of food.
Yes.
I'm full.
And another thing, which, it's a side note now to our discussion of PCOS, but just being present when you eat. And chewing slowly.
Yeah.
Like, it's such a weird thing, but just see how fast you usually eat.
Yeah.
Are you eating in 5 minutes or 10 minutes? That's too quick. Exactly. You have to slow it down.
Yes, you actually have to think about it.
Take your time.
Yes.
Give your body time to absorb the nutrients, for your stomach to be full.
Exactly.
And then you'll realize how much you actually eat in 10 minutes versus slowing it down to maybe 20 minutes or even 15 minutes.
Exactly.
You'll be surprised by how much less you'll eat.
Exactly.
So that's an easy way of actually just being in tune with your meals and actually being present.
Controlling it.
Sitting in front of a TV won't help because then you're mindlessly just eating.
Exactly. You're just I'm one of those people. If I get distracted, I will just finish the whole plate even though I'm full.
Yeah.
Because you're not thinking about it. You're just eating.
Yeah.
Because you're focusing on the TV or whatever.
I know. So it's something that I'm really trying to practice, and I've seen a big difference. Just in my appreciation for food, but also just realizing eating. Why are we eating? Are we eating to be full, or are we eating because it's nice and you want more, which is also okay, but to what extent? So that's just a side note. But moving more towards PCOS, what else besides you, a dietitian? So that's your focus. But what else have you been told, or what else have you found to help with
exercise?
Okay.
Exercise, so important. So this is what I found really helped me. Also helps with the symptoms of feeling tired. And it's resistance training, hey? So resistance training helps so much in hormonal control because it helps with the testosterone balance, the female hormone balance, and that helps with your PCOS.
Okay.
So that's like doing your squats, your lunges, your deadlifts, your RDLs, and gradually increasing your weight. So obviously you can start at a lower weight.
Yes.
And
build
increase
it up to as you can.
Exactly.
Yeah. Okay.
And then three days a week should be good.
Yes.
Yeah.
Yes. So we spoke a bit about insulin resistance and medication and all of that we haven't really touched on.
Yeah.
But that's a bit complicated. And I think just to keep it simple for the viewers, not everyone would necessarily need medication. It depends on your insulin levels, or if your HbA1c, if you've got high glucose levels, if it's needed. Medication such as metformin could be introduced. You aren't on metformin.
No, I'm not. I don't, thankfully, I don't have insulin resistance.
Okay.
But yeah, metformin is one of the treatments of a high treatment of PCOS.
Yeah.
And metformin also helps with the weight loss.
Yeah.
Metformin and glucophage. And then obviously it helps with insulin resistance, which is also going to help with the weight loss.
Yeah.
And also your symptoms.
Yeah.
But with that, you also have to make sure that your diet is correct.
Yeah. So I think it's important, and it's something that we don't always focus on or don't have enough time.
Yeah.
But there's, medical management that we can focus on a bit more, but it's a bit more complicated and needs, a doctor to be involved. But just being aware that there's medical management, and then there's the lifestyle factors which you've touched on.
Yeah.
And that's, so great. So thank you for sharing that. I think it's, it's always difficult to speak about your own experience.
Yeah.
But hopefully it will help our
I
viewers.
hope it helps someone out there. Yeah.
It was
going through the same thing.
Yeah, it was great to, touch on these symptoms. And if you feel that you are experiencing any of these symptoms, please, go to your doctor, get that advice. It's so important to not suffer. There are many treatment options available, and it requires a lot of help from various specialties, and you're not alone. It's actually quite a common.
You're not alone.
It's quite a common thing, and many women are suffering with PCOS, or not suffering, living with it. Some are suffering, some are living with it. So we can bridge that gap.
Yeah.
So it's been a great episode.
Yeah.
Thank you so much for all of the information.
Oh, you're welcome.
It's been helpful.
Yes.
And so what can we do? At this end of the podcast, we can look in the description and see the links that we'll provide, some helpful advice and tips and links. And if there are any questions, please feel free to leave your comments in the section below, and follow us on all of the Instagrams, and we'll put all of the handles in the description below. So thank you so much, Elysia.
Thank you.
See you next time.
See you guys next time.